I am a registered nurse. I work part-time in an emergency department, and then I also work for an OB/GYN office. I noticed that I began not being able to ride bikes with my kids, go up and down stairs. I was just getting extreme fatigue. It was one of those things where I thought maybe I'm just getting older. I have more children now. I kind of have a lot going on in my life, but the fatigue was more, it wasn't just being tired, it was muscle weakness. I went to a neurologist because the fatigue became overwhelming and it started to affect all aspects of my life. I received a phone call that same day after my MRI from my neurologist telling me that she had found an aneurysm. We looked into our family history and found that the women on my mom's side all had aneurysms, whether or not they were aortic aneurysms, cerebral aneurysms.
Miss Anderson actually presented as what we would call an incidental aneurysm, meaning one that was really found by accident.
I found Dr. Fessler through my husband, who is an orthopedic surgeon. He works with Michigan Head and Spine Institute. He wanted me obviously in the best hands possible, and out of the many physicians that he works with, he felt that Dr. Fessler and his group was the best choice for our family.
Most people are surprised to learn that as many as 6 out of every 100 people have an aneurysm, but they live their whole life and never have trouble from it. They may never know they have it.
And Dr. Fessler was very good at explaining that this was a minimally invasive procedure, that I did not have to, have major brain surgery to where I was going to be away from my children, but he also explained that the risks of it rupturing increased every year.
This is a normal artery, but right here, this little globe or this little balloon that is sitting straight up is an aneurysm. And what that is, it's like a blister on a blood vessel.
Dr. Fessler came in and explained what was going to happen, that I was going to have a catheter placed in my femoral artery on my leg.
We performed a minimally invasive procedure called a coiling. And what the coils do is they fill that aneurysm and they actually cause that aneurysm to clot off. And so normal blood flow continues past the aneurysm, but blood can't get into the aneurysm anymore because the coils fill it.
Today I don't even think about it. After the procedure, it was very easy. It was a fast recovery time.
Heather's prognosis is great. Heather was in the hospital about 20 hours. She went home. She has a house full of kids, and of course she was back to normal activities within 2 to 3 days.
I feel that my quality of life is endless now. He's kind of given me that second chance at life where I don't worry about it.
If you have multiple relatives who have an aneurysm, especially if you had a ruptured aneurysm, it's really important that you be evaluated.